An Unquiet Mind, Moods, Madness, and Understanding Bipolar Disorder Through the Eyes of K. Raphael Jamieson. So, who is K. Jamieson? She is a highly respected clinical psychologist and professor, specializing in mood disorder like the one she studies. What makes her perspective so unique and powerful is that she writes An Unquiet Mind from both sides, as a doctor and as a patient. Before we get into her story, let's quickly cover what bipolar disorder is. It's a condition marked by really noticeable shifts, like big swings in someone's mood, their energy levels, and their ability to function day to day. Think of it as cycling between intense emotional states. You might hear the older term manic depressive illness, which Dr. Jamieson sometimes prefers because it clearly describes these opposing poles of mood. Two main types, bipolar 1 versus bipolar 2. For bipolar 1, you need to have at least one full manic episode. So the key difference between these two is the intensity of the up periods. Mania is a period of really high energy and elevated or irritable moods that lasts at least a week, and it causes significant problems in life, might require hospitalization, and can sometimes involve psychosis like hallucinations or delusions. People with bipolar 1 often have depressive episodes too, but the mania is the defining feature. So bipolar 2 involves major depressive episodes, but the ups periods are less severe, called hypomania. Hypomania doesn't cause the same level of impairment and doesn't include psychosis. Based on Dr. Jamieson's description in her book, her diagnosis is bipolar 1 disorder. The main reason is her powerful portrayal of full-blown manic episodes. These weren't just periods of feeling good. They were intense, disruptive, and met the criteria of mania, including severity and, crucially, the presence of psychosis. Evidence of mania, the highs. During her manic phases, she described feeling tremendous, having euphoric highs, and possessing boundless energy. She felt like a wind-up doll that never had to be rewound, and her thoughts would race uncontrollably like shooting stars, making it impossible to focus on simple things like reading a paragraph, and this often lead to impulsive actions like reckless spending that got her into financial trouble and put immense strain on her relationships. She also described feeling grandiose, like a giant, utterly convinced of her own charm and abilities. Critically, for the bipolar 1 diagnosis, these episodes weren't mild. They caused a marked impairment, caused serious problem in her life, affecting her job, leading to financial chaos managed by her brother, and contributing to the end of her marriage. She also explicitly described experiencing full-blown psychosis, including hallucination and delusions during these highs. This presence of psychosis is a key feature distinguishing bipolar 1 mania from the less severe hypomania of bipolar 2. She captures the feeling powerfully, writing, "When you are in the throes of mania, you feel like a giant. Thoughts and emotions zoom in and out like falling stars." The other pole of bipolar is depression. Jamieson describes swinging from those high into a depressive darkness. These weren't just bad moods, they were periods of profound sadness and hopelessness. She writes about debilitating lethargy, where even simple tasks felt impossible, and cognitive fog, where she can't remember simple things. Tragically, these lows also brought intense suicidal despair, leading her to a very serious suicide attempt by overdosing on her medication, lithium. So how was this treated? Her treatment had two main parts. The first one is medication, specifically lithium, which is a mood stabilizer, and she calls lithium a life-saving. But she's honest about how hard it was to accept needing it, and she struggled with side effects and with denial about her illness, often stopping the medication, which unfortunately lead to severe relapses. And second is psychotherapy or talk therapy. He emphasized this was absolutely essential and became a lifelong part of managing her illness, helping her make sense of it all and learn how to cope. What causes bipolar disorder? It's very complex, that there isn't one single answer, but the larger piece of the puzzle we know about is genetics. If you have a parent or sibling with bipolar 1, your risk is about 10 times higher than someone with no family history. And Dr. Jamieson herself mentions this, believing her own father likely had the illness. But it's not one single bipolar gene. It's like hundreds of genes, each contributing a tiny bit of the risk. And importantly, have the genes doesn't guarantee you will get the illness. Even like identical twins don't always both develop it. Genes load the gun, but something else often pulls the trigger. So what else is involved besides genes? Research suggests that there might be subtle difference in brain structure or how brain chemicals work in people with bipolar disorder, but this is still being actively studied. And what seems really important are environmental factors, like things that happen in life can act as a trigger, especially in someone who already has that genetic vulnerability. Things like major stress, losing someone, big relationship problems, intense academic pressure can precede an episode. Trauma, especially in childhood, is also a significant risk factor. Even like things like major sleep disruptions or substance use can trigger episodes. So the leading idea is like gene environment interaction. Inherited vulnerability meets life stress, leading to the illness manifesting. Wrapping up, an unquiet mind does so much more than just describe an illness. Dr. Jamieson's courage in sharing her story really contribute to reducing the stigma of this disorder. And this book shows the intense reality of mood episodes, highlighting the critical importance of the treatment, which is medication and therapy. She also offers a message of hope and resilience. A full life is possible. Thank you for your time.